I can say this, that when a Minnesota kid wakes up in the morning, if they're wondering what their chances of dying of COVID-19, they have 10 times the chance of dying of an accident that day.
Get ready to enter the Thrive Time Show.
We started from the bottom, now we here. We started from the bottom and we'll show you how to get here. Started from the bottom, now we here. We started from the bottom, now we here.
We started from the bottom, now we're on the top. Teaching you the systems to get what we got. Cutting Dixon's on the hooks, I break down the books. Z's bringing some wisdom and the good looks. As the father of five, that's why I'm alive. So if you see my wife and kids, please tell them hi. It's the C and Z up on your radio. And now 3, 2, 1, here we go.
We started from the bottom, now we here. We started from the bottom and we'll show you how to get here.
Yes, 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 and yes, Thrive Nation. We are in the air everywhere. And on today's show, we've tricked a man to be on today's show. This man, he's a doctor, he's a senator, and he thinks that this is a high-quality show. I mean, throughout the years, we have been able to also trick Wolfgang Puck and John Maxwell and the co-founder of Netflix and Square to be on the show. But today's guest is sort of a big deal.
Well,
typically we only get,
he's that poster child for Fox News. I mean,
he's been on Fox News. He's been sharing the truth.
He's kind of like a hot potato right now.
Dr. and Senator Scott Jensen, welcome on to the Thrive Time Show. How are you, sir?
Good. Thank you for having me.
Okay, I want to talk about COVID-19 case inflation all across the nation because I think it's going to change the national conversation. I really do. Tell us how the number of COVID-19 cases are being inflated.
Well, I think we have to look at both sides of it. First off, if we're going to look at the cases and not deaths, I think it's fair to say that for every laboratory confirmed case, we know that there's another group of people out there that have it, but haven't been laboratory confirmed for whatever reason. Sometimes the testing, they reveal false negatives. I think some studies have indicated that for every laboratory confirmed case, we might have another 10 that are not confirmed that are out there. That's what brings the case fatality rate down so much. And the reason that's critically important is because the case fatality rate is what informs so many public policy decisions. Now, where it gets sticky and muddy is when we talk about an inflation of COVID-19 death count, because that's where the big ticket item is. That's where you've got various states saying, we're the ones who are bearing the brunt of this pandemic. And so rather than letting every state get a predetermined allocation of federal dollars, we should get more. We saw that happen with New York State and New Jersey, where after they had gotten hit so hard in April, May, they were making it clear that they thought that those two states, because they had borne so much of the burden of the COVID-19, they should be getting a larger allocation. Because if you looked at how many dollars they were receiving per COVID-19 case, they were getting about $12,000 per case. And in Minnesota, we were getting about $300,000 per case because we were having so few COVID-19. So I think we've seen around the nation, states like Pennsylvania reducing their COVID-19 cases by 200 because the coroners pushed back and said, these aren't COVID-19 deaths. Colorado, the same thing. Kentucky, the same thing. Texas, the same thing. We saw New York go the other way, where New York said, well, we've had a larger number of deaths during this time frame than we've had in the previous 3 years. Therefore, that difference must have been due to COVID-19 cases that wasn't picked up. And they moved 3,700 people into their COVID-19 death count in one day, increasing their number from 7,000 to 10,700.
Folks, listen to what Senator Scott Jensen just said. I'm going to play back for you the audio of what he just said, and think about the profundity of what he just said.
It wasn't picked up. And they moved 3,700 people into their COVID-19 death count in one day.
Let me slow it down so you can hear the profound.
It wasn't picked up. And they moved 3,700 people into their COVID-19 death count in one day.
Wow. Now you, it's interesting when you have doctors who get involved in politics. One, I don't know why you'd make that poor life choice, but I'm glad you did. But Dr. and Senator Rand Paul publicly came out and said, hey, I had COVID-19. I had the coronavirus. He said that he survived it, and see, he's alive, so we know he did.
Well, apparently.
And he said, though, he came out and said that the facts now show that kids are more likely The kids have a 1 in a million chance of dying from COVID-19. The kids have a 1 in a million chance of dying from COVID-19. Is that accurate, sir? Is that accurate that that's how deadly the COVID-19 virus is for kids?
I couldn't speak to 1 in a million. I can say this, that when a Minnesota kid wakes up in the morning, if they're wondering what their chances of dying of COVID-19, they have 10 times the chance of dying of an accident that day.
Wow.
I figured that out statistically. They have 10 times the likelihood of dying of an accident, whether it be a meteor hitting them in the back of the head or being in a car accident. But they have a greater than 10 times chance of dying of something other than COVID-19.
So you're telling me there's a chance?
So we know for a fact that the number of COVID-related deaths are being inflated. That's a fact, sir. Is that correct?
I believe that to be the case in many states. I think in some states, it may not be the case, but I think in many states, we do have an inflation of COVID-19 death counts.
And I have so much ground I want to cover with you, but if you could explain it to me on a third grade level, because I'm not a doctor, how are you being coached? How are doctors being coached to falsely say that somebody died from COVID-19? Because I keep hearing stories about people that had an underlying condition, something else killed them, they had a heart attack, car accident, whatever. And then we keep being told through the media that through here on Fox, Newsmax, One America, that these situations keep happening. How are you as a physician being coached to falsely indicate that somebody died from COVID-19?
I don't think we are being coached to falsely document a COVID-19 death when it hasn't happened. What happened on April 3rd was I received a communication from the Minnesota Department of Health, and it linked to a CDC document. And what it did was it changed the flavor. I felt for the first time in my 35 years of completing death certificates that I was being coached, that I didn't have to necessarily adhere to the same precise sequence of causation that I normally bring to the task of completing a death certificate. Normally, what the CDC tells us to do is look at the initiating event and from there trace the steps that resulted in a patient's demise. What this document that I received from the Department of Health said was, by the way, if you're not sure, but if you think it's probable or you assume it to be the case or it's reasonable or COVID-19 contributed, you can go ahead and put it down as the cause of death. That was new. And that was why I said, this is not right.
Right.
And so I raised it up the flagpole. It ended up, I was on a news program a couple of days later. I was on with Laura Ingraham on Fox News. And this is where I got in trouble because I was told that I was accused of spreading misinformation, but the fact of the matter was I hadn't been. I simply protested because I thought for the first time in my career, I was being coached to not feel the obligation to be as precise as I've been in my first 35 years of completing death certificates.
How much money, sir, does a hospital get if somebody dies with COVID-19?
If a Medicare patient goes to the hospital and has a respiratory infection that's not COVID-19, the hospital will get about $5,000. If they identify that it's a COVID-19 respiratory infection, the hospital will get $13,000 approximately. And if during the hospitalization a ventilator is used, it goes up to $39,000. And that data has been fact-checked by the USA Today and confirmed.
Now, Neil Ferguson, if we can remember, it's so hard to even remember this, but Neil Ferguson initially came out with these models that said 2.2 million Americans might die from COVID-19 and 500,000 citizens of the UK might die from COVID-19. And then they came out, there was kind of a retraction. Dr. Deborah Birx came out, the woman who wears the scarves. She came out and said that 2.2 million people weren't going to die and that 500,000 British people weren't going to die. But now they were adjusting that down
to 20,000.
Yeah, it goes down to 20,000 from 500,000 predicted deaths now down to 20,000, thus meaning that the models were wrong by 25 times.
I'm sure many of you saw the recent report out of the UK about them adjusting completely their needs. This is really quite important. If you remember, that was the report that said there would be 500,000 deaths in the UK and 2.2 million deaths in the United States. They've adjusted that number in the UK to 20,000.
The math of that, and I'm not a doctor, sir, but that would be like me. Sir, how tall are you, doctor? How tall are you?
6 foot.
That would be like me telling my friends, guys, you wouldn't believe, on the Thrive Time show yesterday, we interviewed this doctor. He's kind of a big deal. He is actually a total of 150 feet tall. I mean, that's how bad, that's how it's so off. These models that predicted 2.2 million people might die were super off. But then we said that because 2.2 million people might die, we needed to do a temporary lockdown so that the hospital systems wouldn't be overwhelmed. And now that we know that the models were off by 25 times, what justification is still being used to keep people locked down, these shelter-in-place orders? What justification is being used, sir?
They've moved the goalposts. Initially, we were told that we needed to participate in a lockdown, social distancing, don't touch your nose, your eyes, your mouth, because we needed, one, to delay the surge, depress the peak, so that our healthcare facilities wouldn't be overwhelmed by the number of sick people that would come into them. And we have done that. We did depress the peak. We did delay the peak. We did equip our healthcare facilities, and they just changed the goalpost. We never said that we were going to try to squash the number of COVID-19 cases to zero. Why would we, when we know that 99.9% of people that get the disease will recover? The bottom line is the bureaucrats, politicians, and academics have changed the goalposts and said, oh, now what we need to do is we need to absolutely stop this from happening because we have to wait for a vaccine to be developed. And that notion is not the best place to go because herd immunity is going to be a big part of the solution to this. We have no guarantee that we're going to get a safe, effective vaccine.
Now, I believe that this is a great positive thing that our listeners need to know. I think all of our listeners need to know, and feel free to argue with me, but again, because you're a doctor, but I believe we sincerely do have a cure, or at least a treatment for COVID-19, and I believe we have a cure for the fear. I believe that the treatment, we had Dr. Bartlett on the show, and he was talking about a $237 treatment that involved the use of an FDA-approved asthma medication as well as a nebulizer. We've also had hydroxychloroquine studies that there's all sorts of data coming out, and every time a doctor comes out and says, look, I've treated my patients, and none of them have died. We just had this week, one of my clients, Marty, his family member was treated with hydroxychloroquine. They didn't die. Why are all of the doctors being censored every time they're sharing about a successful treatment of COVID-19? Why is that happening, sir?
Well, we've never practiced medicine by national discussion, and that's what we're doing here. If you go back and look at the Legionnaires phenomenon in Philadelphia, we didn't take on this discussion on a national level with Dr. Fauci having a press conference and saying this and this, and then Dr. Birx saying this, and then every physician, you stick a microphone in front of their face, they say something different. What we did was we looked at all of the potential, if you will, treatments, and physicians talked with one another. They talked with their patients. I mean, right now, we know that we have the possibility that hydroxychloroquine might help some. Budesonide, as per Dr. Bartlett, could help some. Dexamethasone could help some folks. We know that for some folks, remdesivir might be able to help. We looked at Tamiflu. We're going to continue to look at these things. Low flow oxygen versus the high powered ventilator. We need to be able to have these kind of intellectual discussions, and we need to let patients and physicians talk things through and decide, is this something you'd like to try? But what we've done is it's become such a political hot potato that we have physicians who are tearing into other physicians saying, you don't get to have that conversation with your patients because you aren't as smart as I am on this given issue. And so we've just really muffed the whole thing.
Now, Dr. Fauci, Newsweek reported, and I'm citing all of this, but Newsweek reported, it'll be on the show notes, but Dr. Fauci funded the controversial Wuhan lab with millions of U.S. dollars. That's Newsweek reporting. That's not tinfoilhat.com. That's not rightwing.com. That's not clayclark.com. We also know that on the Gates Foundation website, we know that Dr. Fauci has been working closely with the Bill and Melinda Gates Foundation, where he is listed as a member of the Leadership Council, whatever that is. Do you see a conflict of interest there when Dr. Fauci is working closely with people like Bill Gates who are developing vaccines, and he's the one telling everybody that there is no acceptable treatment other than vaccines? Do you see a conflict of interest?
I think a conflict of interest for me is something that's a pretty serious charge, and I think I'd have to look at financial strings. And I don't know that Dr. Fauci has said that the only solution is going to be the vaccine. Certainly he has endorsed and pushed it, but if you go back to his comments in March, he made the comment that there's never been a successful vaccine put together in less than 12 to 18 months. Do I think that Dr. Fauci could have used more discretion in some of his comments? Yes. Do I know if he's going to financially benefit if the only answer ends up being a vaccine? No, I don't.
Okay, how about this? The National Institute of Health recently fired 54 doctors all at the same time for failing to disclose their financial connections to the Chinese. Is that a potential conflict of interest that the National Institute of Health has scientists working for them that are failing to disclose their their financial relationship with the Chinese? What do you think about that?
I do think that's a conflict of interest, and I think transparency and full disclosure should take place here. And I have had concerns even as I look at Gilead with its product remdesivir, and then we see Gilead having a real vested interest in hoping that hydroxychloroquine is not accepted as a treatment, because if Gilead's remdesivir is the only potential treatment on the blocks, that's great for Gilead's stock price. And so I think that we need to be very careful about that, especially when we start to look at the high-handed censorship that was going on last week, when you had physicians who are using hydroxychloroquine simply coming forth trying to share their story, which did result in a contrarian narrative being put out on social media.
Gilead, by the way, is financed by the Bill and Melinda Gates Foundation, also in conjunction with George Soros. So George Soros, there we go. So Dr. Z, we're only going to have a Dr. Senator here for about 25 minutes. So I wanted to get all my bad questions out of the way. Because you're a doctor, you'll have smart questions now. So you go ahead, feel free to ask him some real questions
Dr.
now that
Light.
I've thrown some pretty weak questions in there. So.
Well, I mean, it's exciting. I tell you what, when you have a patient, how much are you doctoring versus senatoring? What's your life look like up there?
I'm a full-time physician, and I probably, in a given year, in terms of work units, I probably see or do about 150%. So I probably do 1.5 practices, and then I'm in the legislature probably about, I'm going to guess somewhere around maybe 700 to 1,000 hours a year.
Now, how many COVID patients have you personally treated?
25.
And what is the treatment you've used, or what have you sat down with your patients and not obviously telling us any names, we don't want to be inappropriate there, but what have you come up with? What's your silver bullet? Have you found something that's been working for you and your patients?
Basically, 40% of people that have COVID-19 won't even know they had it.
Okay.
Another 40 or 50% will skate through it. So I've treated it very much like I treat other respiratory viral illnesses, whether you're looking at a rhinovirus that causes a cold,
right,
or whether you're looking at an influenza virus. So it's been fluids, keep your temp down, stuff like that. But if people start to have shortness of breath or a cough that's compromising respiratory function, then we've sent them to the emergency room of the local hospital, and they've really taken over. So basically, in terms of me prescribing budesonide or dexamethasone or remdesivir or hydroxychloroquine, the only medicines I've used are steroid inhalers, which would include budesonide or comparable agents to dexamethasone.
So you have done that, and of your patients that have gone to the emergency room, what are they doing there? What is your local emergency rooms doing for those patients? Do you know?
Well, most of the time they're making an evaluation as to whether or not the patient needs to be admitted. And if the patient's admitted, then they, in that process, decide whether or not the patient needs to be in the ICU. If the patient's in the ICU, I've had a couple of patients transferred to hospitals where they could be put on ventilators if needed. I think that I've had probably 2 patients put on ventilators and they both recovered. I had one patient that was not put on a ventilator. He refused and he's recovered. I think oftentimes it's supportive care where people are being put on a bed on a medical floor and provided IV fluids, potentially IV antibiotics for a superimposed pneumonia, and close monitoring.
Now, I have a final question that I would like to ask, and then Zeke can one-up me here. But, Doctor, from what I've read about you, it appears as though you have a Judeo-Christian worldview. I don't know. Is that accurate? Are you a Christian, sir?
Yeah, that's accurate. I was in the seminary before I went into medicine.
Okay, and I just want to make sure we're getting this. I believe that faith and fear cannot coexist. And I believe today we do have a cure we have treatments that work. We have people are recovering from COVID, is what I'm saying. Kids aren't at huge risk of this. We have a cure or treatments that seem to be effective. But then we also I believe we have a cure for the fear. And I think we need to stop having alarmist statements being made by Dr. Fauci. If you want to disagree with me, it's totally fine. I'm just saying, I feel like if you were the one doing those press conferences, or Dr. Bartlett from Texas, Dr. Richard Bartlett, who used to be an advisor for Governor Perry, I feel like if you two were up there, we would have a different narrative as a country. Do you agree that if we had a different person sharing, doing their press briefings than Dr. Fauci, we would have a different national perspective to what's going on?
And the question was, what do I think of Dr. Fauci's contribution to the dialogue? I'm frustrated with it. I think you're right. I think that there has been a fear-mongering that is doing nothing for us. If we had people out there saying, what can I do to personally strengthen myself? I'd say vitamin C, vitamin D, zinc. We'll look at some other things if we need to. Lose 5 pounds, get active, be exercising, and for heaven's sakes, be at peace. We know the immune system doesn't do as good a job when people are revved up with fear. So I think Dr. Fauci could have been a lot more measured.
Sir, I've been praying for you, and I'm so honored we got a chance to talk to you because you've been taking a lot of heat for standing up for what's right, and it's absolutely just an answer to a prayer that we've had you on the show, and I hope all of our listeners pray for you as well. Is there a website people can go to learn more about you, sir?
If they just go to Facebook, Senator Scott Jensen on Facebook, they can see my videos. I'm not really big into doing websites. I'm sort of naive when it comes to social media, but I'm learning quite a bit.
Yeah, no,
bet you have.
Now, Dr. Z, final question, then we'll let him get back to treating patients and helping get America reopened again.
From what you've seen, from what you've experienced, from your knowledge, and from everything you've learned up to this point, let's say that some people that have talked about COVID-19 being the pandemic that's going to end the world, we'll call that a 10 attitude. To guys like me that say, it's this year's flu bug, do flu maintenance like you do every year, wash your hands, don't be an idiot, don't eat glass.
Don't lick flagpoles.
Don't run with scissors. The same thing we say every year. And we'll call that a 0. In other words, people, where would you, in your personal opinion,
on the fearometer,
place this virus on that spectrum?
I would put it as a 5. I think it's a clear, real disease. We know that there are vulnerable populations out there that it's heartbreaking for those populations.
Yes.
But I think the fact that the population from 0 to 40 is so virtually completely spared is extremely good news. I think we can get the kids back into school. When we get on the other side of this, I think we're going to look to hold some people accountable, and we're going to see that there were a lot of oversteps. There were a lot of things that didn't need to happen. Yeah. I'd put it at a 5.
Well, I appreciate your honesty with that, and that's what we've been thinking. We think that it's been way overdone, and unfortunately, when it all shakes out, I have a feeling that if this was an election year, we probably wouldn't have had quite the hysteria that we've had.
But if it wasn't this crazy, we wouldn't have been able to have this great man on the show.
That's true.
So thank you so much for being here, and we'll be praying for you.
Thank you very much.
Take care. Well done.
And now, without any further ado, 3, 2, 1, boom!